physics, it's quantum mechanics. Everything's moving, everything's changing in real time. The tumor is morphing in relationship to your treatment. The cells are morphing in relation to your treatment. You need to anticipate them and in a real orchestrated way, treat each patient. So when Mike says, what happens when you come today? Today we have 13,000 requests for treatment in our clinic. We've written over 100 single patient INDs to give them this treatment, and I'll show you the results near the end of this talk. Fine? Okay. Tell me that you pull me off. 2 minutes? Okay. All right, I'm going to go fast then. And by the way, okay, I'll go fast. So this is 2005. We need to get the tumor microenvironment through the GP60 caveolin 1. People thinking was just trying to create expensive Taxol. It was not. It was to take albumin, again, a natural product in your body, to create this thing called transcytosis, so we can drive the paclitaxel to the tumor. And this got approved in 2005. What people didn't realize, we were able to convert M2s to M1s. Now you're converting for the first time using a chemotherapy as an immunomodulating agent. That is why I asked to use this in a low dose in a metronomic fashion. You're not treating the tumor, you're treating the immune system. The next thing was the natural killer cell. Well, I wrote my first paper in the natural killer cell at UCLA in this amazing journal called Hormone and Metabolic Research. It has 3 views. If you look at it, 3 views. So the opportunity for the natural killer cell to kill cancer was this opportunity. But it turns out that all these cells express IL-15, and it is this Anktiva that allows this proliferation and allows this natural killer cell, and shown this to grow in healthy volunteers. And 10 years of work between myself and Jeffrey Shalom and Jim Gully as a creator has now identified all the actions of this IL-15, and by 2024, this, to me, was the most seminal piece of legislation approval in our package insert that says the mechanism of action of Anktiva is a binding of Anktiva to its receptor, which results in proliferation activation of NK, CD8, and memory T cells without proliferation of Treg cells. So what's happened? Well, guess what was number 2? Checkpoint inhibitors, really important drugs. And over the last 4 years, 40 approvals across multiple tumor types with single-arm trials, some of them. Here we are with the challenges facing us today is, what are you going to do? This is from ASCO in 2024. This is from the doctors at ASCO, not our slides, of no treatment for patients who fail lung cancer. Checkpoint, all that's left is docetaxel. So what if you combine 1 and 2, and we did, and showed you increase the ALC, and when you do that, you change the Kaplan-Meier plot with tripling the survival versus 7 months of docetaxel. And on that basis, we got the approval from the Saudis. Now, this is the first approval in the world in which we have 2 more minutes.
Oh, actually, yes. Because we're running over.
Okay, well, I should. Okay, well, I'll stop right here. Let me show you the.
Tell us about all of this and what it means for the future of cancer.
You're seeing it right now. Okay. So here we are, in which we treated this patient's immune system. The patient's ALC, 1,320, 2,300. HPV levels went from 58 to 19 to 0, with complete response. Here we are, the patient with HPV negative, difficult to treat, flew all the way from India, 460 to 1,560. This, I think, is really telling. In glioblastoma, this took protocol 45 years. You get glioblastoma, you get radiation, knock out your NK cells, you get chemo, knocks out your NK cells, steroids, and surgery, and then inevitably you get recurrence. These patients had no chemo. All they had is Anktiva plus a PD-L1 NK cells and bevacizumab. Next patient, so forth. And this patient has no chemo, no lymphodepletion, Waldenstrom, complete remission, now going 15 months. We've seen all these CRs, and we have completed the first preventative vaccine in the nation, in which we've taken adeno plus chemo in patients with Lynch syndrome. 1 in 280 patients in America have Lynch syndrome, over 1 million people. So the future is cell therapy, completely agree, but different cell therapy. Deconstructing an apheresis to a gamma delta T cell, an iNK T cell, an MSANC cell, allowing even allogeneic, and more importantly, developing the world's first AI robot, which will be deployed in the next 3 months, to actually now manufacture these cells and democratize it. And then finally, as we learned this morning, understanding nature's intelligence. 450 million years ago, natural killer cells, and now 50 million ago, I always was really curious, why do sharks not have cancer? And why do camels not have cancer? It turns out they generate a thing called an antibody, a single-chain antibody, different from us, that has a loop that allows this to be used as this next-generation targeted moiety. So with that, I will stop with this mind map, but I think if anybody wants to see this in sort of a much more simplified way, please access this QR code, because I'm being pulled off the stage. Thank you.